Hi there, my name is Oren Landa,
My name is Boaz Lehman.
and I'm an osteopath
I'm a clinical herbalist,
and naturopath.
a shiatsu therapist, and a wild plant and mushroom forager. My English is a bit trash and not so great, but I'm here to talk about plants, so let's start.
Today I'm here to answer some of your questions on CBD. So let's jump right into it and get started. Kiara from Switzerland is asking, what side effects can CBD have? This question comes up mostly because people are associating CBD with cannabis and medication. Guys, you have to let this go. This is a food supplement. Your body is producing its own endocannabinoids, which you would be getting if your balance was regular, your sleep was great, your lifestyle was 100%. You probably wouldn't be needing this. But since we are missing this nutrient in our lifestyle, we are taking CBD, and this is helping to balance our system and get the relief that we want. Just like any other food supplement, if you overdo it, if you're sensitive to it, you might have some minor side effects, okay? These will stop immediately when you stop taking this food supplement. So, try it. The benefits totally outweigh the disadvantages. Kiara, you will have a great time.
Oli from the UK is asking, what the difference between full spectrum CBD and pure CBD? That's a great question, Oli, and a lot of people is asking me that question because it's sometimes confusing. So let's start with the word full spectrum. What mean? We extract the full spectrum of the phytochemicals that inside the hemp flowers. We extract the terpenes, the flavonoids, the waxes, the chlorophyll, and of course the cannabinoids. So we have the full spectrum of extract of the hemp flowers. On the other hand, the pure CBD is simply just a molecule of CBD. So we refine the molecule of CBD until it's a pure molecule, and then we dilute it in oil. So I can show you here the difference. If we look here, the full spectrum oil have color, have taste, have smell, because we have all the plant and phytochemical inside. On the other hand, the pure CBD oil have no taste, no smell, transparent look because there is almost no chlorophyll inside, and I like to call it the secret agent because you take it and you don't feel nothing, only the effects.
Wendy from the USA is asking, is CBD addictive? So, addiction is a big topic. It has social, biological, physiological, and genetic properties that are involved there, so I won't touch on it too much. I will say that no, CBD is technically non-addictive. There's no problem there whatsoever. It simply doesn't work in the same way. If we look at, for example, caffeine and nicotine that we get from coffee and cigarettes, these things will come into our body will want to use them, it'll create more receptors, it will create kind of a need to continue regular function on these molecules, and when we stop taking them, that balance is taken away. So you used to go to the toilet after coffee and a cigarette. You don't drink your coffee and your cigarette, you're not going to the toilet. You're going to do that for a few days and your body will balance out. CBD doesn't work like that at all. It comes in, it doesn't create more receptors, it doesn't create a dependency on a biochemical level. And what it does, it actually contributes to your homeostasis balance. So you're actually becoming more balanced. And even if you stop taking it, you'll actually be better off than when you were when you started. Okay, I hope that answered your question, Wendy. Let's move on to the next one. Camilla from Italy, she's asking, what's the difference between CBD and THC? I'm really effing confused. All right, Camilla, thanks for sharing that. First of all, what's the difference? CBD does not get you high, THC will, okay? They are molecularly structured a bit differently. They both have 21 carbon atoms, 30 hydrogen atoms, and 2 oxygen atoms, but they're structured differently, so they interact differently with your own nervous system and body, all right? They will cause the release of different neurotransmitters and will then have different effects. CBD and THC both have similar effects in some aspects, so they will both be used as an antioxidant. They will both be used to regulate stress hormones. They'll both be used as an anti-inflammatory. They can both cause great benefits in similar ways, but one gets you high, one doesn't get you high. One is more associated with feeling good, that high sensation. The other is more associated, which is CBD, with just a better physical state. I hope that answers your question, Camilla. Let's see what else we got going here, all right?
Bastian from Germany is asking, what will be better for my sleep, the full spectrum or the pure? That's a really good question and not an easy topic to talk about. Basically, what's beautiful about plant medicine is that it's working different in different individuals. It means that if I have my sleeping problem and my friend have sleeping problem, different compounds will act differently and will help us differently. Okay, so in that topic, basically in my clinic, what I see is that the full spectrum is working better because it's have all the excess terpenes and flavonoids and different cannabinoids. Of course, it depends the strain, because there are different strains that will make you awake and other strains will make you more sleepy and relax. So that's really important to choose your full spectrum, right? And if this doesn't help, so use the pure. But in my clinic, I see that the full spectrum is working better for sleep because of the excess compounds and a more wide range of activities.
Uli from Austria. Can I overdose on CBD? First of all, probably not. And I say probably because there is no research that says that CBD can be toxic or overdosing. They give people tremendous amounts of CBD when they do these studies. These are anywhere from 10 milligrams a day to 1,000 milligrams a day, which is like drinking a whole bottle of a 10 ml 10% oil, which is a lot. So no, you can't really overdose on CBD. There are, however, some kinds of what I would call adverse effects. We don't call these side effects because side effects for you could be a really good effect for someone else. If you're looking for CBD for focus and it makes you feel a bit sleepy, someone else that's actually looking to get sleepy will call that a good effect. Undesirable effects would be more things like taking too much CBD that it causes you to be lethargic or slightly feel nauseous. In these cases, we always recommend to kind of lower your dose, take it easy, and let yourself adjust. So, Uli, you can't overdose on CBD that we know of. Mika from Germany. Which is better for pain, pure or full spectrum? This is probably one of the hottest topics regarding CBD, and I think it's one of the reasons that people go to alternative therapists in general the most. It's just pain. Before I get into exactly a pure or full spectrum, let's talk a little bit about pain. What is pain? Pain is technically a signal that's traveling through your nervous system, through your sensoric nervous system, reaching your spinal cord. The spinal cord will say, okay, sending this up to the brain or not, goes up to the brain, and this is where your brain decides, okay, is this signal giving me some information about something that's dangerous or might be dangerous in the future? This is how pain is generated. So really, pain is happening in your brain. Why is this important? Because when we're taking any aid, be it medication or plant medicine, we're looking for something to interrupt any one of those processes along the way. How does CBD work on this? So, CBD is a fantastic molecule that actually connects to the endocannabinoid system, which is a part of the opiate system that we have inside our body. The opiate system, like prescription medication with opiates, is used to downregulate the signals of pain. So what it will do is it will change the way your brain is actually responding to that pain. When you apply it locally, CBD or any appropriate pain blocker, what it'll do is it block the signals that are coming from the pain going to your central nervous system. Another way it does it is by reducing inflammation, and here is where CBD really shines. CBD is great both locally and systemically for reducing inflammation and the pain related from inflammation. The amazing thing about inflammation is that the body knows that when an area is inflamed, it should hurt. And it does that so you don't move it as much. So CBD is great for that. Pure or full spectrum, this is really dependent on the person. We see that some people respond better to full spectrum, some people respond better to pure. From my personal experience, when it comes to musculoskeletal pain, so anything that has to do with the physical body on the outside, joints, muscles, tendons, ligaments, here we really want to use the pure. For some reason, it seems to work a bit better for my patients and our customers at Kiara Naturals. Anything that has to do with a bit more internal, so digestive problems, organ-related referral pain, I really find that, and also of course emotional pain, I find that the full spectrum has a more holistic effect and really people are feeling it more. But again, you kind of have to try both. So, Mika, I hope I answered your question. A bit long, but totally worth it. Ia from Denmark. My father and I want to start taking CBD, but we're both concerned about mixing it with our current medication. Does CBD have any negative interactions with drugs, and will it damage my liver? First of all, we're not doctors. We're not here to give you any direct medical advice regarding your medication. You should always consult with your doctor before you take any food supplement, okay? I use a great engine called Efficasafe. It's available online. We'll add a link and send it to you. You can check drug interactions between medication and any other plant you can think about that's available out there, including hemp, cannabis, and specifically CBD. Right? Not much information there about THC yet, but it'll get there. So always check. From my experience, very little interactions. The only thing to watch out for is things related to heart medication. It should also check, but again, not all medication there has interactions, and really a safe molecule to use. Jorge from Spain. I'm suffering from anxiety and have tried several medications. I'm wondering if CBD can help. I've been suffering from really bad side effects from my other drugs. Okay, so Jorge, first of all, sorry to hear. I know personally that anxiety can really mess up your life, and it's good on you for not giving up. I'm also familiar with the really bad side effects that you can have from these medications. So, to touch on your question, answer your question, CBD is really good for anxiety, okay, at least on a personal level. Again, as we've seen, CBD can be a bit different for different people. We have different internal systems. Anxiety can be caused from different reasons. But in general, what CBD does is it downregulates sympathetic activity, okay? So your fight or flight mode, your need for survival, the fact that everything can be a threat. Okay, this is downregulated by CBD through the work on the nervous system, the adrenal systems, and really getting a much more balanced response. What I find, or what my patients or customers say, is that it gives that extra gap between a stressful situation, a hardcore thought, and the physical and emotional response. So it puts a bit of distance between there, and the most wonderful thing about it is that there's nearly no side effects, and when compared to other medications that you mentioned, this is a completely different world. I will say here, adherence is important. You have to take it, stick with it, find what works for you, and just keep going with it. It'll improve your life, and eventually it'll stay there even if you stop taking CBD. So I hope that answers your question. Good luck, Jorge.